Prynawn da pawb. Is the microphone on? Can people hear me? Yeah? Oh, brilliant, thank you. Prynawn da pawb. And croeso I gyfarfod cyffredinol Blynyddol Iechyd Cyhoeddus Cymru. Pippa Britton dwi, cadeirydd y bwrdd. Dwi'n hapus iawn gyda'r arddoriad sy'n dangos y gwaith rydyn ni a'n wneud i helpu iechyd pobl Cymru. Mae hwn yn agenda gyffroes heddiw, gyda sesiynau a sgrinio a diabetes a chyfle i holi cwestiynau ar ôl. Diolch am deall fy Nghymraeg sylfaenol, dim ond dysgwyr. Bydd geddill y cyfarfod yn Saesneg, ond gofynnwch gwestiynau yn Gymraeg os iawn haws i chi. Diolch yn fawr iawn. Welcome everybody, and very warm welcome to you to the annual general meeting of Public Health Wales. I've got a few apologies for absence today, and they are from Men Core, Angela Williams, Neil Lewis, Nick Elliott, Sian Griffiths, and Kate Young. We've got many people online, our line today, and many people in the room as well, and some external guests who are going to be here. I'd like to extend a very warm welcome to Merys Hughes and Alison Thomas. Hannah is online, and also Jeremiah from Green Voices is signed up online as well. So a very warm welcome to them. For those of you who don't know me and didn't understand the Welsh, I'm Pippa Britton. I'm the Chair of Public Health Wales. I still keep telling people I'm the new Chair of Public Health Wales, but I've been here 10 months now, and I don't seem to be getting away with it any longer. And this AGM, it really gives us the opportunity for people to engage with us and for us to review the achievements from 24-25. And this across the breadth of the whole organisation, lots of roles and responsibilities in the organisation, and gives us an opportunity as well to challenge the opportunities and discuss the challenges and opportunities ahead. There's a really exciting agenda today. We've got spotlight on screening and also on diabetes, and we're welcoming a number of people up to the lectern today to take us through that, so you won't have to listen to me all day. We've also invited questions from the public, and we're going to be taking those at the end. And Claire Jenkins, our Vice Chair, is going to be fielding some of those questions for us. So those are the ones we've invited from the public in advance. But there's also going to be an opportunity, if you're in the room, to just raise your hand, and we can allow you to speak. I think there are microphones on the table for you all. There's also headsets on the table for you all as well, if there are any questions that have been asked in Welsh and English as your first language. And any questions we don't get round to answering today, we will try and post them on the website as well. So please feel free to ask questions in English or in Welsh, and we will put them through translation, as I've just said. And I guess there's a few things that I wanted to comment on. We've had a few changes around the board table over the last year. Obviously, I joined. I think I already mentioned that. And I took over from Nick Elliott, who was one of our non-executive directors. And he stood in as interim for a period of time before I started. Unfortunately, Nick can't be here with us today, but I really want to extend my thanks to him for keeping the ship steady, and also for really helping me with my induction when I first joined. We've said goodbye to Diane Crone this year, who left us in March, and it's a great loss to the board. We miss Diane very much, but really want to record our thanks from the board to her for the work that she's done. Another person who's left us, Hugh George, who's been with the organisation for a considerable amount of time, Director of Finance and Operations, and he has left. And we've got Angela Williams, who's acting as interim at the moment until we manage to find a replacement. So we thank Angela as well for actually stepping up and doing that. And in the room as well, we've also got Hugh David. Hugh raised his hand just a little bit. Hugh is our brand new member on the board for local authority. Welcome, Hugh, and it's glad to see that you're settling in. So we're going to start now with the financial position and accounts. And I'd like to introduce Neil Stoodley, for our interim head of finance, to provide an overview of the financial summary. So Neil, if you would like to come up, and I'll go back to my seat. Thank you. Thank you, everybody.
Okay, diolch yn fawr. Thank you, Pippa. Are you picking me up okay on the microphone here? Great. Thank you, Pippa. And prynhawn da pawb. Good afternoon, everyone. Neil Cyhoeddus. I am the interim head of finance at Public Health Wales. And this is my first AGM for Public Health Wales. So I must say it's a pleasure to be here. And I'm sorry I didn't bring better weather with me. I'm going to take you through a brief overview of the Public Health Wales financial performance for 2024-25. And I thought actually it'd be useful to start off with a bit of context before we get into the performance around the environment that we are operating in. So it is a very challenging financial environment currently. We're seeing significant financial pressures around NHS Wales and the wider public sector. And many organisations are reporting large overspends currently. So some of the good news and the good performance that Public Health Wales has delivered from a financial point of view, which I'll go on to talk about, is in that kind of context of a really challenging time, which makes it all the more impressive. The other point I guess I want to make here is, moving on, is around the wider successes that Public Health Wales have delivered, not just the financial, and recognising, I think, that we've been able to deliver, as Tracy and others will go on to mention, a wide range of achievements, improvements and new developments, all whilst still delivering our financial requirements. So it's been really impressive from a financial and a non-financial point of view. And whilst we're going to be focusing on 24-25, which is last financial year, it's worth reflecting a little bit on the build-up to that and the time prior to that. Public Health Wales, since its inception in 2009, has delivered its financial requirements and its statutory requirements every year since then. Which has been a really impressive a record, actually, and one that not many organisations in NHS Wales can rival. So I think for me that's something that both the organisation and myself personally are really proud of, and yeah, no minor feat. So if I turn to last year and looking at 2024-25 now, which is the focus of the finance update. Public Health Wales has once again demonstrated strong financial stewardship and discipline. And I'd like to thank our finance team for playing a real key role in supporting the wider organisation to deliver that. But also not just the finance team, the whole of the wider organisation and colleagues across Public Health Wales who've all played a key role in contributing to Public Health Wales delivering both its financial achievements and its non-financial achievements in 2024-25. So I'll move on to, I guess, some of the key financial headlines for the financial year. So there's a few things I wanted to pick up here. Our annual accounts, so we have to produce every year at the end of the financial year a set of accounts which have to go through an audit process and be submitted to Welsh Government. So we produced our accounts on time. They had a clean bill of health, an unqualified audit opinion, and were submitted to Welsh Government on time. And for those of you who maybe aren't as familiar with audit as others, unqualified opinion basically means that no material issues were picked up within the accounts, and that's the key thing financially that we strive to get with our end-of-year accounts. So that's a real positive. In addition, so we met all of our financial deadlines, and it's probably worth highlighting again that our all statutory financial duties were delivered in year. So we reported a small surplus, £195,000, and that was part of delivering our 3-year rolling requirement to break even, which is one of our statutory financial duties. And more importantly, I guess, we had an approved strategic plan, which known as our IMTP, our 3-year integrated medium-term plan. And from a financial point of view, having that 3-year IMTP signed off gives us more autonomy in year and more ability to make decisions and use our resources effectively. So that's a real key one for us. We've also continued to meet our requirement to pay all of our bills on time. Again, that's another formal statutory requirement for the organisation, and also that enables those companies who supply us with goods and services to continue to operate effectively when we have that timely payment system in place. Okay. The next slide here, I'm not going to go into the details of this. I guess there's a few different numbers in there about some of our increased spend and growth. The bottom line really is around just emphasising that as an organisation, we have seen significant growth again this year, as we had done the previous year before 2024-25. And we'll come on to, on the next slide, our actual level of income that we receive now as an organisation is up to £265 million. That was our 24-25 income as an organisation. So that gives you a scale of the increase up from approximately £235 million a year before. So a big step up again from the previous year. And we've delivered everything financially and non-financially that we have at the same time as growing the organisation. Those figures do include, it's worth pointing out, the NHS Wales Performance and Improvement Unit, who we host. And then I think the final couple of points that I want to make really before wrapping up is around reflecting on, I guess, the stability of the organisation. So we can see there we're demonstrating net assets of approximately £27 million. We've got cash in the bank at the end of the year of approximately £11 million. So that gives us a really solid foundation moving forward from an asset-based point of view. So those are the main points from the finance report. There's obviously a lot of detail in the annual financial statements, but I'm just pulling out some of the key headlines there. And I suppose in closing, I just want to thank again all colleagues across Public Health Wales for their continued commitment to financial accountability and value for money across the organisation. And I think our ability to deliver a balanced financial position whilst navigating operational pressures and some of that growth we've talked about it's a reflection of the strength and resilience of the whole organisation. And I've got every confidence that we will be here reporting a similar story of financial success again next year. So that's it from me. Diolch yn fawr, thank you very much, and I will pass on to the next item on our agenda.
Thank you very much, Neil, for that. And really big thanks to your finance team And I guess to the whole of the exec team, because I know that everybody in the organisation puts a lot into making sure that we are financially sustainable. And, and it's really good to see that. And thank you for your confidence as well for the next 12 months. Really appreciate that. The next item on our agenda is I'm going to pass over to Tracy Cooper, our Chief Executive, who is going to take us through the summary of activity over the past 12 months. Thank you, Tracy.
Diolch, Pippa. And just to check, can you hear me through this horrible contraption? I'm only wearing it because we've got people online, so I keep fiddling with it. And I'm going to hold you to that, Neil. Where are you sitting? There we are. So this time next year, I can say, Neil, you said that we can have a balance. So yeah, no pressure there. Priandar Pab, Tracy Cooper Ydwi, it is wonderful, I have to say, to see so many of our fabulous people across Public Health Wales here today, and particularly in West Wales. We were really keen to come out to Carmarthen because we're a national organisation and we've got phenomenal people across all of our services across Wales, and we're going to give you a little bit of a showcase, as Pippa said, later on. But it's also wonderful to see some familiar faces and friends over the years, but also some new friends who've joined us. So thank you for investing this afternoon and joining us. So I've got a challenge in trying to do a whistle-stop tour in a contracted period of time to give you a glimpse of some of the phenomenal stuff that's happened across the organisation in the last 12 months. But of course, like every organisation, we always have challenges, and there are areas that we continue to look at improving. But I do want to give you a little bit of a showcase around some fantastic activities. And before I get into a little bit of detail, this frames our world. Neil just mentioned our strategic plan, which is the first 3 years of this, which is our long-term strategy, which takes us to 2035. If we really want to transform health and well-being for our population, it's not about 1 year, 2 year, 3 year, it's a longer-term journey, because we really need to make those informed decisions to create a sustainable society. I'm going to touch on these in the later slides, but the key thing for us as a national public health body is that by 2035 we want to have significantly improved healthy life expectancy for our people and significantly reduced the inequalities that exist across society. But before I go into a little bit of a summary, we really love doing our annual staff events where we bring people from across our organisation together, our staff conferences, and Leah, who's our head of comms, and the team do an amazing job in facilitating that. And as part of that, we asked a number of our staff across the organisation, what are they most proud of? And so we thought it would be a nice entrance to a bit of a summary just to introduce that for you. And this is what they said.
What are you most proud of achieving in the last year?
I think the thing I'm most proud of achieving is being brave enough to change my career after 22 years and take the opportunity of joining Public Health Wales and BPDP.
I got this diagnosed with ADHD at the end of last year, and that has allowed me to manage a lot of my behaviours and my habits and my thoughts, and that has allowed me to not only improve my relationship with my colleagues, but also allowed the burnout support that I've created to get off the ground, and I'm really proud of that.
I'm so proud that our team has spent a year working together closely, but with kindness and compassion. We respect each other, and I really genuinely think that the sum of our parts are better together than individually. We really are a great team to be proud of.
Bringing together ideas from the team, stakeholders and employers across Wales, and then turning them into a fresh, user-friendly digital site for workplaces across Wales to help them with their health and well-being has been a massive achievement.
We're really proud, and I say we because we're a team, it's not just me, particularly for the 2 awards that we won last year in 2024. One was for our Greener Primary Care Wales Primary Care Award Scheme, where we won the NHS Wales Sustainability Award, and then the other was for work we've been doing leading a task and finish group around promoting more environmentally friendly inhaler use in Wales, and that was the Welsh Pharmacy Awards.
So over the past year, I'm most proud of the progress we've made in supporting sustainability goals and embedding more environmentally conscious practices into our work.
We've been trying to sort of get the consistent banding at the right level for our staff for about 20 years to recognise just what fantastic work they do, engaging with parents, sensitively communicating and taking responsibility for a range of different fantastic screening deliveries. So we've achieved that in the last 12 months, which is brilliant. I've been working with a bunch of colleagues to make the labs more sustainable over the last few years, and we're really seeing some progress there. So that's kind of bringing all the Public Health Wales labs together, so that's been really good.
What are you most looking forward to achieving this year?
Fi'n edrych ymlaen i datblygu sgiliau golygu fi a parhau i creu cynnwys ar gyfer Iechyd Cyhoeddus Cymru a creu gwaith sy'n helpu pobl ledled Cymru.
Our service has taken great strides in improving, increasing our involvement in pivotal international clinical trials, including the SNAP trial for Staph aureus bacteremia and Restorative 303. And I think there's really important work trying to help shape the optimal management of infection in the future.
In the coming year, I'm looking forward to supporting the implementation of narrative authorising in the department and across Swansea.
Da ni wir na weddus I gael digon mwy o gydweithwyr ar ein sesiynau croeso, ar ein sesiynau codi hyder hefyd, mwyn ni ddim yn unig targedau, ond hefyd I gynyddu ein capacity mewnol yn naturiol y Gymraeg.
I'm looking forward to seeing the impact of the Leadership Academy and seeing how those who've provided the input, those who've attended the cohort, can help us develop and move towards the desired culture that will help us all thrive, develop and deliver.
It always makes me smile that because it just gives you a little bit of flavour of the diversity across the organisation, and we've got some amazingly passionate people across all of our services. So that just gives you a little bit of a whistle stop of a handful of our wonderful staff. So I'm going to give a couple of slides on some of the key headlines, and then I'm just going to give you a little bit of a flavour across the different strategic priorities. And as I said at the beginning, we're an organisation of 2,500 staff, and there is no way that we can do justice to all of the amazing work that happens across the organisation. So this is very much is a flavour. So just to begin with, I have a massive diolch yn fawr to all of our staff. I mean, I'm so proud to be part of this organisation, and you're going to meet some of our wonderful brains later on this afternoon. The present one exempt, obviously. But our people are passionate. The values of the organisation are all about improving health and well-being across Wales, and that's the DNA that runs through us. So just to start by saying everything that's achieved in the last 12 months is absolutely as a result of some very, very committed, amazing people. So Pippa's already talked about changes to our board. We had changes to our chair from Jan to Nick and to Pippa, who has just been fantastic, I have to say, since she joined and has been out and about and meeting with people, which makes a really big difference. So a big diolch yn fawr, Pippa. And just to say a bit of a thank you to Hugh, as you mentioned earlier, who's moved on to the Joint Commissioning Committee to be their Chief Commissioner, and Angela, who stepped in. So really big thanks. And we also, Claire Birchall was also substantiated, so she can't get rid of us now, in a key role to really drive quality nursing and integrated governance across the organisation. So our focus, as I said at the beginning, about reducing inequalities has become even more pronounced. I mean, you'd expect us to, the clue's in the title, public health, isn't it? But it's quite hard stuff to do. We can't control all the action that happens locally. And so how we influence and work with partners is absolutely fundamental, be it the third sector, communities, local government. The majority of what we do is we work with and through others. So that's been a really key focus, and we've set up mechanisms across the organisation and created some measurement systems to help us track that. 2/3 of the organisation is about the services that we deliver, and you're going to hear that from our infection services later on. So you had a flavour of some of our colleagues on the video were talking about our labs. So we have labs right across Wales that deliver microbiology and what we call genomics, which is sequencing the types of infections that we're talking about. And so just to give you a flavour, over 2 million samples were processed by us last year, and Robin, that's gone up quite considerably over the last couple of years, and it's continued to since COVID. We also deliver all the national screening programmes for Wales. We deliver just under 800,000 screening episodes over the last 12 months, which is significant. This is all about prevention, preventing cancer, preventing childhood and long-term diseases, preventing aortic aneurysms, rupturing. So it is all about prevention. And of course, COVID said it all. We're there to prevent infections or to control the spread of infections when they occur. And that is a bit like whack-a-mole on an everyday basis. So that's a huge part of the organisation, and the team really pride themselves in delivering as excellent a public health services as we can. I started with that, the strategic priorities in 2035. So over the last 12 months, many people across the organisation have been developing not just the activities for the next 3 years, but the activities to 2035, which takes some thinking. Because if we don't get it right in looking at what we envisage and imagine that destiny to look like in 2035, how can we assure ourselves that the actions that we put in train today are going to make any difference? So our route maps are really important for us. They're our journey that obviously will need to flex as times change. As Neil said, huge achievement in managing an underspend in a challenging, very challenging environment. And that takes a lot of internal savings, but also some internal investment so that we can resource where we need to go to really achieve those goals by 2035. And what we're really proud about is our people. I mean, I smile because there's our people on the video, as we have people, our people in the room. So we want to be an organisation where we can support everyone to be the best that they can possibly be, but also an organisation where each of us can come to work and be ourselves, not be judged, be treated in a fair and just and respectful way. And so culture is really important for us. And so our journey around equality, diversity, inclusion is something that we take great pride in. Of course, we're not perfect everywhere, but we really want to be the best that we can possibly be. So we were really delighted that we became 31st ranked organisation around the Stonewall Workplace Equality Index and gold level with distinction from cultural competency with Diverse Cymru. But it isn't about the awards, it's about the journey that we go through, and that's just a constant discussion and a constant focus for us. A lot's happened around our screening services. Screening services never stay the same. We've had some real challenges still around equity of access and our relationship with some of our health boards around delivering some of the services that we commission. But meanwhile, we still transform and we still improve. So we increased the total age range for our bowel screening Wales programme to the maximum now, which was ages 50 to 74 years, which may sound really simple, but it's significant with relationships with primary care, with all of the administrative elements, with the capacity across the system. So it was great to have completed that, what we called optimisation. Our response to infectious diseases, as I've said, has continued significantly. We've introduced new vaccines, respiratory syncytial vaccine for adults, which is again all about preventing vaccine-preventable diseases. Again, that never stays the same. So that's been good activities of business as usual, as well as growth from a public health services perspective. We've also been focused very much with Jim and the team around our health and well-being. So we link with schools, we link with third sector, we link with government, we link with partners right across every sector. And what's been a particularly important area for us is our engagement with the NHS around shifting to prevention. And at the moment, as we look at the things like diabetes, cardiovascular disease, respiratory disease, musculoskeletal disease coming down the line, unless we shift to prevention, we will not have a sustainable health and care system. So we've been focusing a lot with working with primary care and our colleagues across the NHS to make sure that we can give them the evidence, the tools, the guidance to really work with our communities and our citizens to shift to prevention in a way that people get the services they need around well-being and health where they need them, in a way that creates a much more space-focused way of delivering health and care. So that's been really important for us, and we produce a prevention-based health and care framework to do that. So we are also, public health is a global sport. It's not a single country sport. Public health is porous, as we all know. COVID was a good example of that. So we take great pride in working internationally, working across the UK, working internationally with the World Health Organization, with our counterparts of National Public Health Institutes. And Samina, where's Samina sitting? Oh yeah, Samina and our team are our policy and international health team. We do international activity right across the organisation. You're going to hear a little bit about that. But our focus around good public health policy is key. So we worked with Welsh Government in supporting what's called a wellbeing economy, which puts health at the heart of fiscal and economic stability for a nation. So that's been something that we've been working very closely with. And similarly, our team developed, if you like, the best buys of investing in a healthy Wales, the prevention interventions that have the biggest impact and the biggest return on investment. So how we influence policy, decision-making, legislation has been really key. Leah and Ian and the team have led a huge amount of work around making sure our web-based presence is as modern day and accessible. That's and accessible, not unaccessible, in the best possible way. So we've put a lot of investment and a lot of time on that. If we engage with the public, we get a lot of feedback from people, and so we need to make sure that we are meeting the needs of people, what their expectations of us are, and so our web presence has been really key. Also, under Ian's leadership, a huge amount of digital transformation happens in this organisation and continues to happen in this organisation. You know, we want to be a modern day organisation, and we're not everywhere yet, where we exploit data, we create the digital mechanisms that are interoperable, so that we can be as efficient as effective, but also as accessible to our public. And there's some big ticket items that the team have achieved, as well as keeping us on the show. And under Claire's leadership, a lot of focus for us is also about quality improvement. We deliver lots of services, but we also deliver a lot of influence that needs to have the impact. So a huge amount of work that's happened right across the organisation. I'm not going to go into these in detail, but you can read these slides. Just to pick a couple, just to go through the 6 strategic priorities. The wider determinants of health are key. A healthcare service actually only contributes 10 to 15% to overall population health outcomes. So how we influence where people live, how they grow up, what school looks like and what opportunities they have, what their income is, has been key. So this is very much a kind of matrix cross-organisational approach to this, particularly focusing around poverty, focusing around health impact assessment, working with Welsh Government to help partners across public services undertake impact assessments so that significant decisions and significant investments are absolutely focused about improving health and not on occasion worsening health, particularly from an equalities perspective. A lot of work going on with workplaces and businesses, and the team, Jim's team managed to secure significant amounts of money with the Health Foundation, working with Public Services Board to create shaping places for more resilient communities. And then looking very briefly around our second strategic priority, promoting mental and social well-being. Social well-being became prominent terminology for us in the last couple of years, particularly through COVID and the insult, the stress of the impact, particularly around children and young people, but not solely. So that's been a really important focus for us, and you can see a huge number of activities here. Just to pick one or two out, our early years framework is key. The first 1,000 days of life up to the age of 2 is the most instrumental and influential period of any human being's life. So a significant amount of work working with partners to optimise our 2-year-olds in society to help create healthier destinies for them moving forward. We have an adverse childhood experience hub. These are adverse experiences that children may experience, like verbal abuse, physical abuse, sexual abuse, parents incarcerated, parents taking substance misuse, etc. And we know that the significance of ACEs have a significant impact for people in later life. So we have a very active hub, and we've worked with South Wales Police to host the violence prevention unit. So as you can tell, a lot of work has happened to create a trauma and stress-free Wales, working with police, working with criminal justice, working with schools, etc. So really important activities for us. And then looking at healthy behaviours. So healthy behaviours obviously around physical activity, substance misuse, healthy weight, and how we can, as a society, make it easy for us all to make those healthy choices. Often it's out of our control. And so Jim and the team have been focusing particularly around how we work with partners to make it easy for people to make those choices. We run a national Help Me Quit smoking cessation service, so you can see the activity that's increased significantly over year on year. 8% is really quite a considerable increase for us. I mentioned a sustainable health and care system earlier. We know that the projections for type 2 diabetes, which is about 90% of all diabetes, are heading in the wrong direction over the next number of years. And to prevent type 2 diabetes, it's also about healthy behaviours and taking a life course approach. So we've really focused on mobilising our colleagues across the system to focus on preventing type 2 diabetes, because in doing so we will also improve cardiovascular disease, respiratory, physical activity, etc. So that's been a really important one. You're going to hear more about that later on. I mentioned about schools earlier. We have multiple interactions with schools, particularly around mental well-being, as I mentioned, but also physical activity and smoking prevention. If we can influence children and young people at that stage who can also influence their parents, then that's really key. Our strategic priority around creating a sustainable health and care system, I mentioned earlier, really important areas for us. Working with our colleagues that are all about delivering services today, to start to think about shifting left is quite a challenge. So we've been working very closely with primary care, and we've got a great primary care team that comes alongside. Those are the most influential interventions at that point before people get into more established long-term conditions, so really key. You also heard on the video, sustainability, climate change, really important for us. You'll hear some of that later on, but we've also been working with primary care around what that looks around for a greener primary care. We've got multiple primary care assets across Wales, but sustainability is really key in the delivery of those services. And then last but one strategic priority for us, I mentioned earlier about the services, 2/3 of the organisation delivering really key services right across Wales. And those, not only do we deliver business as usual, but as you'll hear, every single one of our services is also about horizon scanning what's happening in other parts of the world, what's coming down the line, where do we need to be, how do we invest, what's infrastructure looking like. And so that's very much the story of all of our health protection and screening services. So this gives you a little bit of a flavour of them. We've also got a fantastic genome sequencing unit that during COVID was 3rd or 4th in the world around sequencing, and it provides a great asset for us for health protection and control and diagnostics of infections. And then finally, our final strategic priority around tackling the public health effects of climate change. I see this as accelerating for us over the next number of years. I mean, everybody's rehearsed on the challenges of climate change. We absolutely haven't got on top of it as yet, but a lot of work happening, not only as us as an organisation to be as sustainable as we can be, but also for us to help the system, and a lot of leadership coming out of our health and sustainability hub in different parts of the organisation to drive that through. So finally for me, that's very much about the kind of what we do from a public health perspective, but what's absolutely key is how we do it, and particularly many of our teams and directorates across the organisation that provide that advice, that technical expertise to ensure that actually how we do it is moving us in the right direction. So just to give you a little bit of a flavour of some of the activities that we do to enable the successful delivery for today and tomorrow. We launched our revised people strategy. As I mentioned earlier, if we don't have the amazing people, we can't deliver the functions, and we certainly can't deliver the functions to the quality that our people in Wales need us to. So our people is really key around that. We've got very active staff networks, and we developed a new neurodivergent network group as a result of our people wanting that over the last 12 months, which is very vibrant and fantastic. As I mentioned, a lot going on around digital research, data and AI. What does that look like? It's already here. How do we want to control some of the destiny to exploit that in a safe environment? I mentioned around our 2035 goals. If we can't measure the impact that we're making, if we can't measure those big ticket numbers around healthy life expectancy and reducing inequalities, how on earth do we know whether we're making the difference or not? So Ian and the team have developed very much an underpinning measurement system so we can track the state of the nation and then do something about it if it's not going in the right direction. Also, the reason I've put points for tomorrow is that two really big ticket items for us, thanks to Welsh Government approving. One, the CABSEC announced a number of months ago, which was the establishment of a lung cancer screening programme, which will save tens and tens of lives for Wales. So the team, Tom's with us today, representing Meng, so our screening team and our digital team are supporting developing a lung cancer screening programme that will take a couple of years to be fully implemented, but will be a big lifesaver for us. And then finally, a lot of learning out of COVID, and obviously having end-to-end linked to local authorities' health, digital data systems that keep us on top of controlling, managing, detecting infections. So we secured a significant funds for a new integrated health protection system, again, which will save multiples of lives through a different lens. And finally, just to say a really big thanks, not on this slide, but to Paul, put your hand up, Paul, little twirl, and the team. I've mentioned COVID a few times. We are still living it with the UK COVID inquiry. That takes a significant amount of time. And just to say a really big thanks to Paul and the team. Robin gave evidence fantastically earlier this year, as did Meng, who's swung it in Marrakesh as we speak. You'd have thought he'd made a priority for the AGM, wouldn't you? But there are multiple members of our teams who have been given evidence and working, and so that is still very prominent for us. And then finally, we have to link in internationally, because we would be failing in delivering our work if we weren't horizon scanning. And so, obviously, the AGM, I've got Paul giving me a prompt there. Thank you, Paul. Well, I've given you the flavour of what of the achievements of the year across the organisation. But our AGM is also about launching our annual report. So you can see these beautifully bound annual reports. The old version in the previous currency of a hard copy, but obviously they're all online. So. And they really do showcase fantastic stuff that's happened, and this is very much a kind of whistle-stop tour of it. So I will stop at that, and I will hand back to Pippa. So diolch, Pippa.
Diolch yn fawr iawn, Tracy. Thank you very much. And I'm always struck when I listen to Tracy talk about the organisation, about just how amazing our staff are, and the breadth of the work that goes on, and actually how much everybody, I mean, that's one thing I've found as I go around the organisation, is just how much everybody cares about making a difference to the lives of the people in Wales. And I think really it's a huge thanks to Tracy for her leadership in this as well. I think absolutely, Tracy, you just demonstrated that to us. So thank you very much. And I mean, and a really huge thank you everybody to contributing to the stuff that you'll see in the annual report, and also all those things that Tracy's just been talking about. The next item on our agenda is I'm going to invite Tom Fowler. Tom, if you'll come up, and you're going to take us through a spotlight on our health protection services. Thank you.
Thank you. Diolch yn fawr. We decided that what would be we thought would be most interesting to people was to take a particular focus on one area of our services. As Tracy said, we cover screening services, we cover health protection services, but we also cover infection services. And I have colleagues who are going to come up and do a more detailed talk about that. I'm very briefly going to touch on some of the different areas that we do outside that, so that colleagues who are not in infection services also get to see some of their work being demonstrated, and to give you a flavour of those different types of activities that we do. But I do have to apologise, perhaps mostly to our colleagues in those other services, because I'm going to rush through this bit really quickly to give as much time to the infection services as possible. Starting with our health protection team, for those who are not aware, it provides specialist public health protection advice on infection disease control, working closely across the whole system of Wales. We have several different regional teams who are based throughout Wales and aligned to the different areas. So we have some specialists in North Wales, South East Wales, and then Mid and West Wales. And in a moment, I'm going to talk about some of the work that the West Wales colleagues do. And they all work really closely with regional partners. So just again, Tracy said it, but we are actually, we are part of a system. That's partly what public health is about. And if we're not supporting the system and interacting with it, then we're not really doing our job. So core functions, what does actually health protection do? It does infectious disease control, and this is about stopping the spread of infection. It does outbreak response, so leading investigations and interventions into communicable diseases. So when we see an outbreak in a care home or some other type settings, then we will lead the work to try and make that stop, preventing it from being worse than it is having started. But we also do proactive work to try and reduce the risk. And then we collaborate, working closely with health boards, particularly in this area, Hywel Dda and Swansea, along with other agencies. So supporting the West Wales region, we're working closely with the health boards. We've developed pathways for administration of HNIG. This is, for those of you who don't know, it's what you give if a person is exposed to measles and they're a pregnant mother or they're an immunocompromised child or baby. And really important that we do it incredibly quickly, so makes a real impact. We've looked at our resources and pathways to support scabies outbreaks in care homes, and so we've worked directly with that. We've reviewed local port health processes and arrangements, so improved that. And we've undertaken 2 community TB and bloodborne virus events in Carmarthenshire, one in response to a case. So lots of different work. And then we've also developed a Public Health Wales forum with local authorities where we routinely discuss GI, which is gastrointestinal infections and Legionnaires, sharing training, support and opportunities. We work with Swansea Bay to set up a community health protection steering group involving local health protection services. Again, reviewing all of this work so that we can learn and take this forward. We have the Swansea Bay Strategic Health Protection Group, which oversees a number of subgroups, viruses and elimination plans. We do seek to try and stop and eliminate certain viruses and infectious diseases. And then a lot of support around TB, particularly for those with high-risk lifestyles. And this is coupled with high levels of engagement with clinical services. The health protection team has actually delivered a number of things, and Tracy has already covered that. I particularly want to mention the TB services, but also innovation as well. So work on unpasteurised milk, work on TB find and treat services, and of course a personal favourite of mine is a lot of the digital work. And again, what's key to a lot of our health protection response is the information that we gather in that allows us to determine a response. So I am an epidemiologist. I love data at heart. I don't tell the epidemiologists because I sort of moved on from that, but I still do love it. And things like ENOIDS notification, I appreciate that that probably means nothing to most people, but it's really exciting because the faster that we can do that, the more information it is for action, the more impact that we can have. So particularly passionate about those sorts of things. We've been recognised. One of our consultants in health protection received an MOD medal for sort of their work around families arriving at West Camp in St Athens. And we've also been doing lots of work with our workforce because we need to continue to stay at the forefront of doing that. 1 year, Tracy has also mentioned this, but I just wanted to say huge amount of work. When I look at the fact that we've had over 6,000 different cases, to know that we've been responding to all of that makes me really proud of our system. Population-based NHS screening, moving swiftly on. Screening looks for early signs of disease and for those who don't have symptoms, and in essence we're trying to take a preventative approach in that particular area. I should say, and again I think this is really important, screening is not 100% perfect. Actually no diagnostic test is 100% perfect either, and perhaps my infection colleagues might actually mention that later. But being able to act on it and get the population good is really key. We have screening programs that work in different areas of the life course. So in mother and baby, there's diabetic eye screening that is from 12 plus. There's cervical screening, which is through most of the adult lifetime, but not the older age. Breast cancer screening from 50 onwards through to 70. Bowel cancer screening from 50 on through to 74. And abdominal aortic aneurysm screening from 65 onwards. And just to give you a flavour of the sorts of things that they're actually trying to deliver, breast cancer screening is to detect cancer early to stop mortality. Cervical screening looks to reduce cervical cancer, bowel cancer, we're looking to reduce mortality there. Well, a number of steps, again, similarly with Wales, abdominal aortic aneurysm screening, that's to prevent ruptures, detect aneurysms and prevent mortality. And then newborn blood spot screening, a newborn hearing screening, again, to reduce mortality, but also to be able to intervene to reduce the impact when things are detected. And then diabetic eye screening, which is to prevent eye loss. And antenatal screening to reduce mortality and morbidity in women and their babies. So all things that are really important. We've mentioned a number of the different highlights already, but just to go on again with our focus on West Wales, this is here for information for people, but I would just like to pull out, we do have local services, we do have mobile services, we have a great focus on saying how do we reach all of the population in Wales. Again, I've mentioned my love of technology, and out of West Wales, out of our colleagues who are based in West Wales, we've done things like led the IT replacement programme for Canisc, and again, that has an impact across the whole of Wales in improving our services. So we really are a whole Wales organisation. And I'm actually going to stop there, and hopefully I've done that fast enough to give you, Robin, due time to do justice to the areas that you're going to talk on. So if I could hand over to you, if that is okay.
Right, thank you very much, Tom, and thank you for the opportunity to speak here. I'm Robin Howe, I'm the microbiologist and the director of the infection division, and you're going to hear from me and Julian Rogers, who's the interim deputy head of operations, and Kelly Ward, who is the interim head of operations for the division. And some of you met some of my colleagues who work in the local laboratory earlier in Glangwili, who have joined us as well when you were having a tour around the laboratory. So our public health driver is patient health to public health. Infection is unique in the fact that the management of my infection affects your health. So if I'm badly treated, if that's badly managed, then there's a potential for my infection to spread to you. If I get inappropriate antibiotics, there's the potential to increase antimicrobial resistance and make your infection more difficult to treat. And so it's our public health priority to ensure that there's optimal treatment of infections across Wales. And we're doing that. Our objective is, to enable the wider health system to prevent and reduce harm to individuals and the population from infection by providing our clinical and diagnostic excellent knowledge and expertise and our services. So, give you an idea of what we do. So we have an annual budget of around £52 million, and we've got 704 people in our budgeted establishment. And as Tracy said earlier, we just topped for the first time 2 million samples processed last year. And I guess just to put that into some sort of perspective, because 2 million sounds like a big number, it's also, obviously many people have more than one sample sent, but when we track through to how many people that is affecting, it's about 80% of those are coming from individual people. So that's about 1.6 million people that we've helped last year, about half of the population. And as you can see from the monthly graph of how many samples we process, one of the challenges operationally is that the number goes up and down, and it can vary from one month to the next by as much as 15%. So that makes it difficult for us to deliver the service, and of course it makes it difficult for our finance colleagues to predict how much we're going to spend month from month, year from year. And so just to give a bit of an overview, the diagnostic service we've got, we deliver diagnostics for the large majority of NHS Wales. We've got 14 laboratories spread all around Wales. Some of them more rapid testing laboratories, some of them local laboratories, and some of them more regional hub laboratories. There are 3 laboratories outside our network, and obviously we would like to bring those in due course. And we also provide clinical services. We provide clinical microbiology, in fact, to some of the laboratories that, and health boards that we don't actually own the laboratory. We also provide clinical virology across Wales and infectious diseases in Cardiff and Swansea specifically. And again, there are non-Public Health Wales clinical services in a couple of the health boards providing some of their services, and we would seek to merge with them in due course. I'm just going to say something about the clinical network and the challenges that we face and you know, what we've been doing about it and where we see ourselves going. And one of our big challenges over a number of years has been around recruitment, particularly recruitment of senior clinical staff. And so what we've worked on is the development of blended clinical teams, and we aim to expand that. And at the same time, we've been establishing training of both medical and clinical scientists into consultant roles outside our initial hub of Cardiff, so that we can encourage people to train elsewhere and then take on substantive posts elsewhere. Just to give a little bit of, you know, sort of background to that, a few years ago, the Royal College of Pathologists gave us a complicated equation to say how many consultants we needed. And the slide shows how many we need. So in Hywel Dda here, that said we needed 10. And as you can see, at the moment, we've got 2. And that's a long way from 10. And we have a real challenge in particularly Hywel Dda and Iechyd Cyhoeddus services in delivering with consultants. So what have we done? Well, yeah, there are some finger in the dike actions, such as locum consultants and bank consultants. But actually what we've been doing is, as I said, developing a blended clinical team. So we've engaged specialist grade and specialty doctors into the service, but we've also developed a whole new type of staff, which is physician assistants. And we were the first in microbiology to develop physician assistants in microbiology. And also another totally new breed of person, a clinical biomedical scientist, to provide particular liaison with clinical teams, and also an advanced nurse practitioner. So, and we have also expanded clinical training to Swansea and expanded clinical scientist training, so that we've moved from 2018, when we had a service delivered by just under 23 consultants, to a clinical team of 66, which is much more sustainable. Not all the expansion in consultants that we wanted and still strive to get, but delivering, I think, a quality clinical service. Other elements that we've been working on and issues for us is, because of those challenges with recruitment and where we have staff, is equity of service. We want the same quality of service in Aberystwyth as in Cardiff, and we're doing that through remote working, through remote authorising, development of narrative reporting, and also developing a more network-based virology service. We're keen to develop infectious diseases further. We have established ID services, having just had them in Cardiff. We're now in Swansea as well. And we're looking to develop ID services in the next 2 years in North Wales, and also see if we can in Aneurin Bevan. And we seek, as I said earlier, to have an all Wales service that encompasses all clinical and diagnostic infection services. So I will now, I will have one more slide that gives you the vision of the future of the clinical team, and it is really just one that is depicting equity with national networks in infectious diseases and virology. And now I will pass over to Julian.
So, thank you everyone. This is just to give a bit of a flavour for what we do in microbiology, because as Tracy said, it's scratching the surface. So just a bit of focus on current successes and where our aspirational ones are. So the uniqueness about Wales is we have a network. So we have 14 laboratories, whereas if you look at England, they're standalone laboratories. So when we roll out a new process, we may do it in one site, and then the other 13 sites can replicate it and not have the costs that are associated with the big evaluation initially. So that has satisfied our UCAS assessors to add to our scheme of examination. It makes it a much more resilient service and envious. We have been to lots of national conferences where they say, how do you do it in Wales so well? How can we learn from you? And that's because we have a resilient network. So, MPOX. August 2024, WHO declared a national emergency, a public health emergency, and they wanted us as a first responder, the Welsh Government, to roll out a process in Wales. At that moment in time, we were sending the specimens to UK HSA site in Porton Down. Obviously, that has transport logistics, that has turnaround, so that's not ideal for the patients. So we undertake an evaluation validation in Cardiff. They did it, we replicated it, and now in West Wales, we run the process twice a week to meet the demand that's in this area. Well received. Obviously, it doesn't just do MPOX, it does LGV, herpes, syphilis, that sort of thing, so it has a lot more resilience and provides a better, wider target. Rapid bone and joint diagnosis. If you've been in the laboratory this morning, you've seen that when we culture things, it takes 24, 48, 72 hours. That's obviously not ideal to treat an infection. What we need is something that's responsive. So, thank you. We got in-year variants money last year, which allowed us to pilot, which you may have seen this morning with Rian, the rapid bone and joint platform, which gives a result of 50 minutes once it's been loaded onto the platform, not 24, 48, 72 hours. So this has a real good impact on the patient. It means they may not have surgery. They may need to relook at the antibiotics they're on. And also, it identifies 36 targets, some of which we can't culture because it's not culturable. So it gives us a wider scope and also more targeted approach. Rapid hot and lab sepsis diagnosis. So if we went back 5 years in time, we had 6 locations in Wales where we had no presence. Thanks to COVID, loosely termed, we were able to put 6 laboratories in sites we had no presence in before to meet the demand of the pandemic. As respiratory testing has gone down, we've looked to expand the repertoire within those hot labs, and we put blood cultures into those sites. Those people aren't aware, there is a standard that says you need to have loaded a blood culture within 4 hours of taking the specimen. If you've been in West Wales, you know about the geographical remoteness of some laboratories, so therefore we've put these blood cultures into these sites. They're loaded within 4 hours instead of waiting for transport costs to spoke laboratories. So that's been well received, and that is available throughout the West. Molecular enteric diagnosis. We are in stage 1 of, we've implemented a Ceresept system in Wales. In the last 12 months, that's gone to Carmarthen, and we're looking at our stage 2, which is looking at an extended panel, but also in collaboration with our partners in Withybush, the non-public health Wales laboratory, supporting them, bringing that into the whole of the West so everybody has equal access to the service and not just the traditional method that they're doing in the West. Also, as part of that, picking up on your sustainability, we have, so each specimen would require up to 7 plastic plates. We no longer need to do that for the majority of specimens which are negative, so that would have filled this room multiple times. We've reduced the single-use plastics, and also downstream where the waste, the autoclaving, big, huge ovens that got high temperatures to make them sterile. So that's a real plus point for us. Future, value-based healthcare. So I'm just going to get Rian to put her hand up, to look at Rian, Richard to put his hand up. So those are two SROs that are leading two work streams. Rian is looking how we process ear swabs in Wales. Richard is looking how we process urines to make sure it's fit for purpose to make the patient's needs. So it's more focused about them. Are they sending the right specimen? Is that specimen required? Do we need to investigate it? Do we report things? Do we do the appropriate sensitivities to make sure it's more patient-centric as opposed to what we think is right? Robotic automation. If people may or may not have been to North Wales, we have an instrument out there called Keystra, which microbiology is very manual. You receive the specimen, you open it up, you plate it on a plate, you spread it on a plate. You take that plate, you put it into an incubator. You take that plate up the next day and you read it. So we want something that's going to open, inoculate, spread, incubate, read, give us the result to allow us to focus on the things that are important, the complex specimens that have got lots of growth on them that we need to investigate, not the ones that have got no growth, we don't need to investigate, and we don't need to spread. It's a very manual process, so we're looking at that. And we're also working with the PMO office to be able to say, we need, obviously, any instrumentation, a lot of cost, a lot of money, a lot of investment. We need to make sure it's right and do an options appraisal. So that's on our agenda going forward. Parasitology, we talked about AI. Obviously, Digital Wales, they want us to be at the forefront of digital technology. We're looking at feces specimens. We do a microscopy. We look for a parasite. It's very manually intensive. Part of the problems that we have in Wales is recruitment at a specialist BMS rate, grade, to be able to look at these. So therefore, you want something that's going to be able to screen out the negative to focus on the more complicated cases, which are positive. So that's on our agenda as well. FW Listeria. Darius, do you want to put your hand up? So people that met Darius this morning in the Food and Environmental Laboratory, I think some people were surprised that we had food and environmental laboratories. Obviously, one of the things you will have noticed, it's a very manual method as well. He gets 25 grams of food in, he cultures it, he enriches it, he subs it, he incubates it. He reports back in 72 hours that you may have a listeria problem in your sandwiches. We want a result within 8 hours. So we are looking at food and environmental labs doing PCR testing to be able to be a more responsive service to meet the demands of the users. That's very whistle stop. I'll hand you across.
Thank you. So I'm going to finish off to just give a bit of explanation as how us working as a network enables us to deliver the 2 million tests a year that we do, and how that enables us to support regions that are more geographically disparate, like in West Wales. So, and when we talk about West Wales, we also include Mid Wales. So our geographical area that we cover regionally includes Aberystwyth as well. And I think the distance from around Bridgend area up to Aberystwyth, if you're going to drive all the way today, is touching 160 miles. So it's quite a big difference that we've got to cover and provide resilience for. So looking at the themes of challenges and what we've achieved, and then where do we want to go with that? So our biggest challenge, one of our biggest challenges, was providing and being able to continue to provide equitable training opportunities for our staff. And as Tracy said, our staff and our people, we've got over 600 people in the division. Without them, our service wouldn't run. They're clinical, they're scientists, we've got administration staff, and we need to be able to provide development opportunities for all of those people to keep our services going. And as Julian said, in terms of our science, we need equipment and we've got lots of machines, but if we didn't have people with the expertise to say, yes, that answer is right, we couldn't provide the quality service that we do. So given our labs are very far apart, so we've got Brongleis up in Aberystwyth, and then we've got Carmarthen here, we've actually introduced some rotational training opportunities for our training staff. Carmarthen and one of our hot labs in Llanelli, we've got 2 members of staff who do cross-training on a rotational basis, and that's going really well, enabling one of the members of staff to become qualified, and also enabling the staff member who is qualified to go and work in a hot lab, experience something different. And going forward, we need to embed that as a more permanent structure, and that's going to require some challenging conversations around where we place people when we appoint them, giving them opportunities to travel. But in terms of our resilience going forward, it's going to be what we need. We do offer rotational training across all of our network, and all of our labs support it. We have challenges in our regional sites where we've got such huge numbers of staff in training, and we've got 50% of our workforce currently on some level of training programme, whether that be pre-registration or post-development. And we want to continue that because it's really important for our staff. Another challenge we had, and Julian mentioned this in his presentation, was around our laboratory accreditation of our tests. So we want all our tests to be of a high quality standard, that are accredited, that we can be confident when those results go out, we know they're the right ones. And our quality team has worked really hard to bring that process so all of our labs are accredited at the same time. It's a huge undertaking. Everybody dreads the time coming up when we're going to have assessors literally running across all our sites asking questions. But it's done with the team in such a streamlined manner that it supports all of our local and smaller labs, so everybody's doing the same thing. And that team will work centrally, they'll work regionally, so they'll work with Richard, then they'll work through Rian into the people in the lab who then have an interest in that to deliver that on a day-to-day basis. To continue to do that, we need to maintain our quality team. We need to make sure we develop that service, and also continue to add every one of our tests to that extension to scope. That does require a significant amount of paperwork and questioning, but it's something that we always want to achieve for us as a network. Another thing we've done is to develop specialist network teams, and quality is just one example, and I've listed the others in the bar there. This is so that in our smaller sites where we've got less staff, so in Aberystwyth we've only got 10 members of staff, and they provide a whole microbiology service from top to bottom. So they don't always have the resources and resilience to be able to manage all of our health and safety issues, our quality issues, our LIMS implementation. So we've developed teams that are run by a network lead that sit within the central management team, that link in with our regional managers and then link in operationally to make sure all of that process continues to happen, and that we as a leadership team have complete assurance that if anything happens in any one of our sites, that message gets to us really, really quickly, because we've got the governance processes in place to make sure we can achieve that. Going forward, for us, it's going to be important to review the structure of those teams, because actually the workload in them is significant. Some of them are set up differently, and does that need to change or be different? And that's going to be part of our ongoing workforce planning, which is going to be important for us. Transport logistics was a huge issue, particularly around Mid and West Wales. But COVID's helped that a little bit in terms of we had to really ramp up our transport to be able to move samples across our network when we were only testing initially in 1 or 2 sites. We've now got different contracts in place so we can guarantee we can safely transport highly pathogenic organisms across our network and across into the wider UK. We've got specific models that suit the region. So in North Wales, we've got a bespoke transport where we run our own GP courier service transport to make sure that we get samples into the lab on time so we can process it. But going forward, how our transport services look is going to be very much dependent on how our network looks, and that may need to be reviewed and changed. But it's particularly important in terms of resilience. So, for example, currently in Aberystwyth, we've got a few staff challenges. So Carmarthen and Singleton laboratories are supporting that service. We're able to transport samples down to those labs, get them processed. It doesn't affect our turnaround times, and patients' outputs are not affected. But likewise, Aberystwyth has got a fantastic Category 3 lab, which is completely sealable. So in terms of helping out each other, if we have a problem in Carmarthen or Singleton, we can easily transport samples up to Aberystwyth to get that process and to get it done, which is brilliant. And I'll link the last two together. So some of you have been to Carmarthen today, and you will have seen some of the sites. Lots and lots of our sites, we sit as tenants in health boards. We have no control over that infrastructure, and it takes a lot of challenging conversation to get anything done. But it's really important for our staff to give them the best facilities to be able to work in. For our containment level 3 facilities, we've actually made huge strides in the last couple of years. We've replaced 50% of our Class 1 microbiology safety cabinets, and we've got complete sealability in 5 sites. That might not sound very many, given that we've got 14, but to achieve sealability is a huge undertaking, and because we're sat within old buildings in health boards where we can't control if they change windows or how their electrical ducting works, the fact that we've got 5 sites is a big achievement for us, and we know we can maintain resilience in our service with those sites. We are looking at how we can replace some of our Cat 3 facilities by basically building a room inside a room, so we make our own room sealable. But for us, it's going to be weird if we're able to get funding to support that. Where should it go? Where's it best placed to make sure as a network it's right, rather than just replacing like for like because we've got services in some places. And then that links on to our last bit around our estates generally. Now we've got some really lovely sites. We've got IP5, which is a really lovely site if anyone's been there. If you know, as a young scientist, this would be the perfect place I'd want to work. It looks beautiful. And we're looking to utilise that space to its maximum efficiency. Our Pengu and genomic services have moved to Corriton, and again, those laboratory services are brilliant compared to some of our other sites, which don't look like that. And when we move staff around the network, that's one of the challenges we have, because they see other sites and they think, well, why doesn't my site look like that? But Carmarthen has just had a molecular refurbishment, which has been, again, another huge undertaking to get Health Board Estates on board to get it done. But now it's done, it's great, and the staff are really happy that we've invested that time and money into them. So for us, for myself, Robin, Julian, and the rest of the management team, a biggest part for us now is how are we going to reconfigure our services for the future? And ideally, this sort of mirrors Robin's map for the clinical services, but this is for diagnostic. So we want to maintain our 3 regional hubs. That's really important. And currently, lots of them house our reference services as well as our food, water and environmental services. But we want to be able to provide the same testing across all of Wales. Rapid molecular testing that Julian touched on is hugely important, both for immediate patient outcome, but also for influencing pathways around outbreaks and ward closures and maintaining infection control. So that's something that we're lucky enough to have on all of our sites, and we need to maintain. But also, where do we put culture? What labs need to culture what specimens? How should that look? And that's currently an open book at the minute in terms of what we want to do, and there's lots of conversations going on there. In terms of the local testing, we would definitely want to keep our mainstay samples because we don't want any effect on turnaround times or patients, but it's how we do that within the current envelope and staff that we've got. And I've just checked that I want to, no, we finished. Just checking if Robin wanted to close, but thank you for giving this the opportunity to present to you today, and it's been great to meet some of you I haven't met before. Thank you.
Diolch Tom and the team. Thank you so much. Very, very informative. Also want to extend a big thank you to the staff at Llangwili this morning for hosting us. I learned an awful lot that I really didn't know before, and all about water testing and food testing and all sorts of diseases that I didn't know anything about as well. So a huge thank you actually to extending that welcome to us, because I think the board really want to get out and about and visit the labs, and we don't always get the opportunity to do it. So, I'm really grateful that that's been arranged this morning. I'm just kind of looking at the time at the moment, and I'm sure everybody would like to take a short break before we move on to the next session on diabetes. So it's 2:20 at the moment. So how about we all reconvene here at 2:30, give everybody time for a short break, a cup of coffee and a visit to the toilet. So thanks very much, everyone. Everybody, diolch yn fawr croeso nôl, and welcome back everybody. I hope you've all managed to have a short break, and we'd like to move on now to our next item today, which is Spotlight on Diabetes. So Jim, please, if you and Rachel wouldn't mind coming up to present. And I know that it says Jim, David and Rachel, but unfortunately David's not very well today, so we wish him all the best and a speedy recovery. Thanks, Jim.
Thank you, Deal. Can you hear? Okay, so Bryn da pawb, Jim Melas dwi, cyfarfod y Cenedlaethol Iechyd Cyhoeddus, and I'm going to ask my colleague Rachel to introduce herself.
Hello, I'm Rachel Byrne, I'm the Director at Diabetes UK Cymru.
So the eagle-eyed among you will have spotted that I'm not David Taylor, and I won't do as good a job as him, but the good news is we won't be taking up the 50 minutes allocated, so you'll be pleased to know about that. And we're going to talk to you about diabetes together, tackling diabetes together, or in Welsh as we call it, diabetes gyda'n gilydd. It's probably Tracy and Ian's fault that we're here. Well, I'll blame you anyway, that we're here today, because on World Diabetes Day 2023, Public Health Wales published projections that suggested that by 2035, 1 in 11 people in Wales could have type 2 diabetes, which, as Tracy said, is largely preventable. And that would be about 260,000 people. That's quite a lot of people. And when you multiply that up by the fact that if you end up in hospital having an amputation, your risk of death rises to over 30% in some cases, and about 18% if you don't have an amputation. So we're talking about lots of lives lost, we're talking about lots of cost, we're talking about lots of misery and lots of pain. And so we created in 2024 this programme called Tackling Diabetes Together, which had two strategic aims. The first was by 2028 to halt the rise in prevalence in type 2 diabetes. That's a really quite ambitious target, but we feel we have to do it. And you'll see as we come on some of the challenges we've got. The second was to improve the quality of life and the outcomes for people with living with diabetes, both type 1 and type 2, measured by the rate of complications, rate of amputations, and a number of other measures. There is no reason why we should not be among the best in the world at preventing diabetes and helping people with diabetes live long and healthy lives. And if you've seen the projections that have come out recently from various places about premature death, you'll see that diabetes is quite an important cause of that. So in the last year, the programme has been launched. We have a stakeholder board, which Rachel sits on, the Tackling Diabetes Together, along with Health Board Chief Execs and a whole range of other people from across the system. And we have had a number of achievements I won't go into detail about, but one thing is we've got into the metrics and performance system for Wales, how Wales is doing on uptake of the bundle of 8. In other words, we've built some of the system conditions in, and sadly, we haven't improved. So there's still work to be done. But what we have done is we have rolled out 3 apps to help people with diabetes manage their condition. And in a few minutes, Rachel's going to tell you about one really exciting thing was the hackathon, which had people coming from as far afield as Haverfordwest to a day with patients in Pontypridd to talk to us about their experience of the pathway and how we could do better. And we'll come on to that. So the Tackling Diabetes Together programme, which David Taylor, our programme director, joined in June, is busy working away to deliver the outcomes that we're trying to achieve of reducing prevalence and improving outcomes. And apparently I'm not boring enough, so I have to talk. I think it's on yeah. Even more loudly so that you can hear me. So that's a quick introduction to the programme. I won't say any more because There's some really exciting stuff coming that I want you to hear. So Rachel, I'm going to hand over to you if I may.
Yeah, thanks, Jim. I don't know which one. Don't want to use both. So I'm Rachel. So I'm from the charity Diabetes UK. Hopefully, most of you will have heard of our charity. But if you're not aware, we are a UK-wide charity. I lead the Wales branch of the charity, and we're here to support people living with diabetes and also people at risk of diabetes, particularly type 2 diabetes. We also work with health systems and with healthcare professionals to try to educate, raise awareness, and to try to kind of drive improvement, making sure that the sort of voice of people with lived experience is really at the heart of policy making and practice. And also, you might be interested to know we're also the largest funder of diabetes research in the UK, because what's really important to us is that we're working together for a world where diabetes can do no harm, and part of that is around some of the really exciting stuff that's happening in terms of developments in science, in terms of immunotherapies, and thinking about how we can delay the onset of diabetes and potentially even prevent and cure diabetes in the future. So that's just a little overview of the charity that I work for. We were really delighted to be... there's a giant picture of myself above there, slightly off-putting. And we're really delighted to be invited here today to speak and to be part of the AGM today. And we really welcome the partnership that we've got with Public Health Wales and with the Tackling Diabetes Together programme. And we wanted to talk about just some of the things we've done together over the last year, just as an example of how Public Health Wales can really and truly work alongside third sector and stakeholders in a genuinely collaborative way. So going back to, as Jim mentioned, we launched the launch of the Tackling Diabetes Together programme happened last November, and we actually ran a joint launch event. So it was organised by Tackling Diabetes Together comms team, but they invited us as stakeholders along, and us and another charity were able to bring together a load of people who are living with diabetes. And on a very rainy, very cold day in Cwmbran, we came together at a football club, and this was people with all different types of diabetes. It was kind of a peer support event essentially, and they were playing football and getting some exercise, chatting about diabetes, and we invited the media along. We chatted to BBC and to ITV about the launch of the programme. So it was a great way to kind of kick off what was to be a good collaboration. And there's, I think, a clip there from the...
So quite a few of us here tonight. We're here from Charities Diabetes UK Cymru, and also members of the community and the Cambrian Football Club to talk to each other about diabetes. So diabetes is on the rise in Wales, so at quite an alarming level. It's something that is going up and up, and so we need to work together really to tackle that and to make a difference. And so as part of the Tackling Diabetes Together programme, we're all here to make sure that we're thinking about diabetes and how we can support one another as a community to make a change. So the Tackling Diabetes Together programme is led by Public Health Wales, but it really is a joint effort. So we're bringing together a number of different people from within the NHS, so clinicians and Welsh Government, but also thinking about charities, third sector, communities and people living with diabetes to make sure we're all working together towards the same aim, which is of course reducing the prevalence of diabetes here in Wales.
So as you can see, we had some really good and really positive coverage, and it was lovely to be able to do that jointly. And we really kind of started as we meant to go on, and we've had a number of opportunities to work together. As you can imagine, a lot of the aims of our charity align extremely well with the aims of the Tackling Diabetes Together programme, and so there were just many kind of natural opportunities for us to be speaking together. And my feeling is that our voice is strengthened and vice versa by working together. We improve the sort of legitimacy of what we're saying, we improve the reach, we could potentially reach different audiences from one another by bringing together the communities that we're speaking to through our collaborative work. So really keen to work together whenever we can. Another example of that was around the All Wales Diabetes Prevention programme. This is something that we've championed from the start as a charity. We were delighted to see that this programme come into fruition. We know that England has a really established prevention programme, national prevention programme. Scotland, Northern Ireland, not so lucky, so we were very, very pleased to see the programme being launched in Wales, and we supported that all the way through. And we were equally pleased to sort of celebrate the evaluation results, which happened in June, I think it was this year, Diabetes Week. So I don't know if you want to speak about that a little bit, Jim.
Happily. I get to share the data because I'm boring. So you might have seen the evaluation published. Ian estimated that diabetes costs us 10% of the NHS budget. That's a conservative estimate. So we need to prevent this. So the evaluation published this year, and I just want to share with you a couple of the figures. The first thing is actually All Wales Diabetes Prevention Programme can reduce you going from pre-diabetes to type 2 diabetes by 23%. It reduces the number of people going on. That's quite significant from a brief intervention. So there's a 23% reduction in progression. The second thing is, actually, if you look at the number of people who continue to live with pre-diabetes, you're talking about 2/3 of people with pre-diabetes will continue living with it, which means that they're in a space which is treatable and intervenable. But there's another outcome as well. And I had to read this twice the first time I read the evaluation report, which is actually that the All Wales Diabetes Prevention Programme is one of the best things at stopping people progress from having diabetes to getting worse and making complications. So it's 23% higher prevalence of blood glucose at normal levels in the people who went on the programme. That's quite important, because actually the higher your blood glucose, the more you're likely to get complications. The programme is being rolled out across Wales at the minute. We've got 4 of the 7 university health boards that have it in all of their clusters. The rest are on the journey. We want to see it rolled out everywhere. It's one of the work streams that is within Tackling Diabetes Together, but obviously has been led by our primary care team and is a really important intervention, I think, for Wales. We can do this. I think that's what the AWB DPP shows. But one of the things that Diabetes UK Cymru and colleagues have done is you've legitimised among people with diabetes the need to take on these programmes and actually the standing. So things like the apps. We've rolled out 3 apps for people with diabetes in Wales. One for people with type 2, one for women with gestational diabetes, and a third for people with type 1, and other work is on the way. Now, we wouldn't have got the uptake, and the uptake is rising, not as fast as we'd like, but we wouldn't have got that uptake without the work that people like you and people living with diabetes did. So this has been co-produced from the start, and that's the value of it. I can stand and shout at people all I like, but actually, if I don't have legitimacy from people with diabetes, it's not going to touch the sides. So the value of our working together has been crucial.
Thanks, Joe. Another area of working together we wanted to talk about was around the Time to Talk public health survey and the inclusion of new questions around type 2 diabetes and particularly around people's understanding of their own risk of type 2 diabetes and their openness or having had already taken steps to reduce their risk of type 2 diabetes. This is something we feel really strongly about, that in order to be able to see behaviour change, we will obviously have to have understanding first. People have to have an awareness of what risk means and whether they are at risk in order to be open to the idea of making the changes that may be able to mitigate and reduce that risk. So we were really happy to be involved in the creation of those questions and the inclusion of those questions, and then to see the results from those, which give us some really important information and data moving forward. And I don't know if you want to get back to the data man over. Yeah.
Where's an epidemiologist when you want one, Tom? So a couple of really important things from this survey. The first is that 1 in 5 people we surveyed are taking steps to try and reduce the risk of diabetes. But that means that 4 in 5 people that we surveyed aren't. 77% of people that we surveyed were either interested or very interested in an online tool that helped them identify their risks. And the picture of people knowing what the risk was for diabetes was actually really quite mixed, wasn't it? I mean, you know, a lot of people knew if you were running to the toilet every 5 minutes, that was a bad sign. But actually, things like if you had thrush infections repeatedly, that a lot of people didn't know that. About a third of people had no idea that that was a sign. And that went up. But what it challenged was the idea that diabetes is inevitable, because that idea is out there. It's in the community I grew up in. It's in some communities. It's in Pontypridd, where we went, for example, where people talked about it as inevitable. So the survey has shown that people are starting to take care of their health, but actually we have an awful lot longer to go. And I think the survey really gave us some legitimacy. Remember, over 70% of people wanted a tool that could help them understand and manage their risk.
Yeah, thanks, Stuart. And I think the other thing that was clear from the survey was that, as you say, some risk factors are more well known than others. The correlation with obesity fairly well known. Some of the other correlations with things like ethnicity far less well known. So there are some groups in our society who are less aware, even though they may actually be more at risk of diabetes than others. So that's something really important to think about in terms of equity in how we approach this. And we've got then a little clip. There were some, we went out and did some Vox Pops, or Public Health Wales rather did some Vox Pops, the Tackling Diabetes Together programme did. And we were really happy to support those and to be able to share those on our digital channels together. So we're just going to show you a short clip of those Vox Pops that happened on the streets, talking about the questions that were in the Time to Talk survey.
But on the road. So how many risk factors for type 2 diabetes can you name?
I would say weight, healthy lifestyle or healthy living and diet, family risk factors, probably about my limit, really.
No, that's great. So it's things like being age 40 and over, if you've had diabetes while you're pregnant. How many risk factors for type 2 diabetes can you name? None. No, that's fine. So if I can just give you some examples, they would be if people were physically inactive or being 40 years and over, or if they've had diabetes during pregnancy. Sawl risk factor math diabetes wyt ti'n gallu enwi?
Oce, mae chi'n meddwl am cario gormod o bwysau, diffyg ymarfer corff, yr elfen deuluol, bod fe'n rhedeg yn teuluoedd, oedran hefyd.
Yeah, so pobl sydd dros 40 oed a hynna.
Yeah.
So if you found out that you were at high risk of having type 2 diabetes, what changes in your life would you consider making?
Definitely making sure I'm having the right diet, right exercise. If I didn't know about it, history check with the family.
Exercise for sure, food, maybe some intermittent fasting and things like that, because I think the Asian population anyway has a higher risk rate of type 2 diabetes anyway. So I think food is the main one, and exercise. Yeah. Definitely.
Wonderful. The only other additional one that we encourage is that if people find out that they decrease the amount of alcohol that they drink if they drink alcohol.
Everything. Diet, exercise, taking on the doctor's advice, doing everything I could to make sure that my blood sugars came back down.
So yeah, you can see there just, I mean, I'm sure you can feel it in the room, just the power of actually hearing from people, just normal people, actual people talking about some of these issues. And that's one of the other things I think that I wanted to talk about today, and some of the value that comes from the collaboration of working with third sector. Third sector naturally are very in touch with people, but so the bread and butter of what we do is working with people who are actually living with the condition. And so it's really important, I feel, to work with third sector in order to make sure we're raising that voice and making sure that the voice of those with lived experience, true lived experience, is kind of integrated and threaded through everything that's happening in terms of strategy and planning within the programme. And that's very much been the approach that you've tried to take, so that's been great. So on that note, I wanted to just reference an event that was planned by the Tackling Diabetes Together team that we were again able to support. So we went along to, we brought some staff along to, we were able to get some people with lived experience along to, and it was called a hackathon. It was actually quite an innovative event, and by that, if I let you know, there were guitars involved and there was poetry involved, so it was slightly outside of the box, slightly outside of the comfort zone for some people. Others absolutely found it wonderful and creative, but the idea really was to bring together a range of different stakeholders. There were about 60 people there. So we had healthcare professionals, we had stakeholders like ourselves, like people working within the third sector, as well as people with different types of diabetes, type 1 and type 2 diabetes, coming together to talk about their experiences, talk about how it felt, whichever perspective, to be working with or living with diabetes. What were some of the blockers? What were some of the challenges? What were some of the things that were working well? What were some of the ideas for how we could overcome some of those challenges and come up with solutions? And this creative approach really helped to sort of open people up, make them think a little bit differently, and for some people allowed them to sort of speak more freely, I think, in a way that can be quite challenging if you're just sort of doing flip charts and writing bullet points on a flip chart. It can be a little more difficult. So it was something different, and the great thing about it was proactive. It was organised by Tackling Diabetes Together, out in the community, listening to the voices of people. And the thoughts were gathered around a number of key themes on the day. So one of those themes was around self-management of diabetes, and this is something I think is actually quite unique. Well, it's not entirely unique, but it's particularly pertinent, I think, to living with diabetes in a way that perhaps it isn't for other conditions. When you live with diabetes, you have to be your own nurse and doctor. You have to be monitoring your own blood sugar levels on a constant basis, obviously administering your own medication. So the role of self-management is especially, as you will know, especially important for diabetes. And so empowering the patient and making sure the patient's in a good place to be able to do that is extra important. So that was one of the themes discussed. Also discussed digital tools that can be used, and as Jim has spoken about, that's something that the programme's really keen to push forward, and I think is the clear direction of travel in terms of patient empowerment for the future. And there was also some blue sky thinking, people giving ideas for things that were perhaps not necessarily that easy to do, that obvious how we might do them, but just thinking about what they'd love to see in an ideal world. And so, I'd suggest anybody go and have a look at the paper that's been written about that hackathon. It's really interesting. There's some stuff that everybody agreed on, some frustrations that everybody felt in common, certainly, and things around lack of consistency, for example, which we all kind of know about. But there were also some really specific ideas, some sort of quick wins there for things that could happen that could bring about change. And this was just a great example of raising that patient voice, making sure that we're working together, listening to one another in that event setting. And it was really, I think, just the sort of start of that type of work, which the programme is really keen to do and to involve stakeholders like ourselves in. So we really enjoyed that, and I think it's a great example and one to go and have a look at if you have the time. The other thing I just wanted to mention that I think is really important, and I feel that third sector organisations, charities can really bring to the joint work that we're doing, is around the issue of peer support. We know that a person's journey with their health condition isn't just about the clinical care they're receiving. Of course, it's about, they're a person, they have an entire life outside of their condition. Just like anybody else, they need support of family, friends, other people. And we often hear from people living with diabetes that they can feel quite isolated and quite alone. Diabetes can be an relentless condition to live with. It's pretty constant, or it can feel that way. And it's not necessarily something that is particularly well understood in terms of how serious it is and in terms of what the sort of management is really like on a day-to-day basis. And so that peer support and making sure people have that peer support at the time that they need it, which very often is going to be early on in the diagnosis, early on in diagnosis, it is really important. And I think that's a strength of third sector and community organisations is they do bring people together to be able to talk about things. I was actually speaking, I said to Jim, I was speaking to somebody, she's a woman, she's in her 30s, I'd say, the other day, and she was telling me that she had gone to a sort of peer support event organised by us about 20 years ago. No, it can't have been, yeah, it's about 20 years ago. I think she was a teenager. And up to that point, she'd been really struggling with her diabetes management. And it's very common for young people to sort of struggle with living with diabetes during the transition time between childhood and adulthood. It's a difficult time for everybody, particularly difficult if you're living with diabetes, maybe moving away from your support system at home, perhaps in a new environment like university. Moving from paediatric care over to adult care is another challenge to overcome. So it's a difficult time, and she was struggling with her management to the point where she developed some complications and she'd begun to have sight loss because she just wasn't really engaging with her condition. She wasn't managing it in quite the right way. It was a difficult time for her. And then she'd gone to this peer support event, which was a cookery event. So it was just an event where other people living with diabetes came together. They were learning some cookery from a chef. But she said, at that event, she saw another young person injecting themselves openly with insulin. And that was the first time she'd seen that. She'd never seen another young person or another person injecting themselves openly. It was something she felt a lot of shame about personally herself. And then she had a conversation with the other person and was able to talk to them. And she said that started a friendship which exists to this day. And for her, she felt that event and that experience of that peer support had been life-changing in terms of how she dealt with that condition and how she's gone on to live her life. And I wanted to give that example just because I think it highlights just how essential it is that we're not just thinking in terms of clinical support. We need to be thinking about the more holistic picture, and that's something I think you're keen to support as well, isn't it, moving forward?
And I just want to emphasise a couple of points around prevention here, because the more engagement you have with people living with diabetes, the more outcomes you get for prevention. So if you build a culture where people have the information to self-manage and self-care, you can also build social norms around understanding and preventing diabetes. We know that. Other countries have done it. The second thing is, which is one of the reasons why we're working on a point of diagnosis package, working with people with diabetes. Second thing is that the more you build an ecology of self-care, the more you are able to turn patients into partners with clinicians. And that leads you to prevent progression, which actually is one of the things that we're trying to do through the Tackling Diabetes Prevention Programme. So you can build social norms, you can build progression, but you can also get their expertise into people who are newly diagnosed through things like the point of diagnosis package that we're making. So for us, there are real benefits, and there are benefits that you only get from people living with it. And we know this from other patient movements, and we need, I think, as the UK, to get better at that. And one of the programmes going forward on Tackling Diabetes Together is going to be increasing the work we do on peer support. Another programme as we go forward will be the point of diagnosis package. There will be more work done on the app so that we can really begin not just to do the basic things like piloting a new eye screening programme where you don't have to dilate people's pupils. That will make a difference, but actually you also do the work with patients. It's a both and approach of empowering people and changing systems to give people the best outcomes. So it's my turn to kind of finish it. And if David were here, he would say, you've done a rubbish job, Jim. But he came in June. He's done a review, interviewed over 40 stakeholders across the system and had focus groups. We've refocused the programme after a year. We took it to the Public Health Wales Change Board and to the Tackling Diabetes Together Board. And the thing for me is that we are united around 7 big programmes that will do prevention, that will look at systemic change, where we will work together as a system. Public Health Wales's role in this is actually about being a system catalyst and bringing our expertise and our energy. And Ian and Tracy created a burning platform. We really welcome your feedback on what you think we could do better and what we're not doing. But for me, I think the benefits of working with you and with people with diabetes has been that the programme has had a reach into real people and an information from real people, a shaping by real people living with diabetes that it would not have had otherwise. So I'm not saying it's the best thing we've ever done, but I'd like to offer it to you as an example of how we work together with others. And just a big shout out to the programme management team, the finance team, the comms team, Diabetes UK Cymru, the Diabetes UK, the Tackling Diabetes Together team, David, Tracy, Ian, the board, for all the support in taking on this programme. Thank you, and thank you for listening. Diolch yn fawr iawn am wrando.
Diolch yn fawr. Thank you very much, and thank you, Rachel, so much for coming, and thank you, Jim. I think it's really great, actually, to have had you here, Rachel. It really shows that kind of partnership working in action, which we talk about a lot, and I know goes on a lot, but we don't always have it presented to us. So it's really great. And my personal thing is we ought to get more fridges into hotel rooms, just because I think that that's one of those things, isn't it, for keeping insulin cool that, you know, people don't think of, and it's a small amount of cultural change. And, you know, there's a lot of progress to be made still, but it's great to see just how far we've come with all of this, and it's a really great programme. So thank you very much to you and to Jim and to the team, really, for all of the work that's gone on, and to the board for supporting it. I think we're going to be moving on to the questions now, and so what I'm going to do is I'm going to pass over to Claire Jenkins, our Vice Chair, and she's going to deal with the questions that we've received. Thank you very much, Claire.
Diolch yn fawr, Pippa, and shmai pawb. So it falls to me to do the question session, and we asked before the event for members of the public to come forward with questions if they had any, and we've had quite a number. So I will start asking these. Meanwhile, anyone in the room or online who's got questions brewing in their mind, please hold them, because hopefully, if time allows, we'll have the opportunity to to go around. And please feel free to ask those in Welsh or English, because I have help and I'll be able to answer them on that basis. So, question 1, who we've had from a member of the public. I've noticed that some children are not enjoying PT lessons in school. Is there a way to incorporate yoga and Pilates into school curriculum as a way to address obesity and musculoskeletal problems in the future? I've noticed that quite often the teachers are not allowing the children time to move around the class, which leads to back pain. It'd be great if there were some recommendations for schools regarding moving around the class or some movement breaks incorporated. Are there any ways to address this? So I think, looking around the room, I will go to my colleague Jim, who hopefully will have an answer for us. And to Mike.
I'll stand. Can you? Oh, you can hear. Great. Well, the short answer is there are mandatory standards on physical activity that we've been working with Welsh Government on, and they encourage teachers to do a variety of things. So it is possible to include yoga and Pilates, but I would just say that yoga and Pilates won't reach the threshold of moderate or vigorous activity you need to tackle obesity. And actually physical activity itself, as we all know, is not the answer to obesity in and of itself. It's really important. So there are national standards. We've also got a national programme called the Daily Mile, which is rolled out across schools. We're working with our colleagues from Sport Wales on that. And we've got links into local sports partnerships. And there are new health and wellbeing standards in development for schools that will enforce that even more. And I have to say, we've met an open door with schools. So if the questioner wants to talk to us more about that, I'd be delighted to look at what more we can do to promote it. But one of the things we want from physical activity is the benefits for kids' mental health and for their cognitive development, but also actually for their posture and for their musculoskeletal development. Now, yoga and Pilates are good for some of those, but actually for some things we'd recommend other things. So let's have a conversation.
Brilliant. So an excellent question and a positive answer, which is always nice as well. Right, we have more. We have quite a few, so I'm gonna roll on with these. Next question. I've noticed that patients who come to the UK after the age of 15 are not being offered the HPV vaccine, despite the fact that they're eligible till the age of 25. So I think people coming to the UK. Is there a way that someone can monitor the patients who missed their vaccination but are still eligible according to their age? If these patients were offered the vaccine, it would reduce the number of cervical cancer cases. And on this one, I'm going to go to Tom.
Thank you very much. So if I could start off by saying, really good question, and it's important, we believe this strongly, that we ensure as many young people, both boys and girls, are vaccinated as possible with HPV, as this reduces their risk in future life of cancers, of developing cancers, including cervical cancer. So the way that we deliver HPV at the moment, vaccine, is primarily it's given in schools in year 8. So that's children who are aged 12 to 13 by the school nursing services in health boards. And they check on the vaccination of status. But additionally, eligible young people are able to get vaccinated by their GP if they miss doses or are homeschooled. So they should be able to be checked at their GP practice and this sort of vaccination delivered. Now, in Wales, we record where the vaccinations on the children and young persons integrated system, and we check at when they're leaving school where they are with regards to that. But the person who makes the question raises a very good point, because sort of vaccinations that are done outside of Wales or sometimes done as part of catch-ups, part of the GP initiatives, aren't necessarily included in that. And that's one of the reasons why we're working as part of the National Immunisation Framework for Wales to support Digital Health and Care Wales to develop a lifetime vaccine registry. So basically, it's a really good idea that we get a full list of everything, and we are working on that, and we will continue to work on that.
Lovely. So my understanding then from what you said is actually people are eligible up until a certain point, but the onus might be on them at the moment to go and make themselves known. And we're working on that really important way of tracking through a lifetime that will help with that. That's really exciting. Thank you, Tom.
Thank you.
We've got another HPV question, so brace yourself. There's more coming your way. So the UK MCS recommends the HPV self-sampling option for under-screened women in cervical screening programme. When is HPV self-sampling going to be available in Wales? Is it possible to start offering a walk-in HPV screening in GP surgeries and breast clinics? Some patients find it difficult to schedule and come for a separate HPV appointment. If walk-in screening was available, it would raise the coverage of the screening as patients could do their HPV screening right after seeing a GP. If HPV screening were available in breast clinics, it would be very efficient to do both female screenings the same day. And so, Tom, over to you again.
Thank you very much. And again, this is a really good question, but it's actually a really complicated question, and there are a number of different aspects of it. So I will try my best, but do feel free to summarise me. First off, Public Health Wales will be introducing self-sampling for underscreened individuals as part of the cervical screening programme, and we're aiming to do that in mid-2026 in line with the recommendation. So the recommendation comes out and it takes a certain amount of time to implement, and the recommendation in this case is that you do self-sampling for HPV in those who rarely or never engage with screening. So it's a particular subset of that group. We do care very much about this because it means an underserved group has another option, and that's again really important. But it's not just as simple as then rolling that out to everybody. Because another aspect is that cervical screening, which is done every 5 years, is really, its effectiveness is highly dependent on the quality of the sample taken when you're doing it in the standard way, and that requires training and experience, and that really impacts. So there is a workforce that does that, and so that makes it harder to then just do that type of screening with other sets of people in other situations. And we want people to do that more. So the HPV is, if you're not doing that, this is the next best thing, which is important to do, but not the same, at least at the moment, as you're doing that. So that, again, is part of the reason, but that requires specialist sets of skills and experience, which means that you can't just open it in a variety of different settings and it be self-sampling. And then finally, there was a question about breast cancer screening and GP practices. And again, you come back to the need that, the breast cancer screening, our systems are set up in a very specialised way in that area. And so it wouldn't be as simple to then be able to do this in both settings. That being said, we really care about access. So ideas like this and thinking like this and saying, how can we improve access for these particular groups? It's really helpful to have the challenge, and we will continue to think about it. And we are working through how we will actually deliver the programme at the moment.
Lovely, thank you. Okay, I think any attempt to summarise that might go horribly wrong, but let me just say, I think we are aiming to do some of the sampling by the middle of 2026, and we're looking at these ideas and a range of others to try and improve access for people. I wonder as well, just ad-libbing slightly, I know that we promised that if there were questions that we didn't get to, we would publish the answers. So I'm wondering if we could just publish all the questions alongside the answers. Everyone's nodding, so that's great. So that means that those people who've asked the question can get that detailed answer going forward. So that's brilliant. Right, I shall go on to the next one. This one is about lung screening, so brace yourself, Tom, because I think it's coming your way as well. So there's no lung screening available in Wales. It's available in England. Why are lung checkups not available in Wales? The lung checkups are desperately needed in Wales. My friend's mum died from lung cancer when she was 58. She had no symptoms. If she'd had a checkup at 55, she would have lived. it's a time to start lung screening in Wales to catch lung cancer early. So just sad story, and I think our condolences first of all go out to anyone who's lost a loved one from this or anything else. But we heard a bit about it earlier, but Tom, maybe you can give us a bit of an update.
Yes, so I would agree. It's sort of brings home why it is that we actually want to do this and want to make an impact. As was mentioned as sort of one of the successes, so in June 2025, Welsh Government confirmed their commitment to us rolling out a lung cancer screening programme. Again, implementing something like this is huge, and challenge is the wrong word, because it's not a challenge, but it is difficult to bring a new screening programme into live service. But we have been tasked with doing that, and we're leading on that, and we're working towards it. And so we've already set up a team that is looking at how they would implement it. It will take several years to get up to the full level that we want it to, but we agree, and that's why we're doing it.
Lovely, thank you. And
I think Tracy wants to come in.
Just to add that Public Health Wales and also the Cancer Network for Wales have been working with Cymru Morgannwg Health Board to implement. Sorry, Mike, thank you. You did that very subtly. Just saying that Cymru Morgannwg Health Board have been undertaking a pilot into lung cancer screening that we've been supporting as Public Health Wales screening team, but also the Cancer Network and 10 of us as well. So that has shown some really successful results. And of course, lung cancer screening is particularly, the evidence is around targeting at people who have ever smoked. And so there's quite a high incidence in that community. So it's not only is it about detecting lung cancer, but it's also about detecting insidious conditions that perhaps wouldn't have otherwise been detected to help. So, you know, it's a prevention or an early detection. So just to give a shout out to CTM, because they've done some amazing stuff, and that helps shape the lung cancer screening programme as we establish it as well. So thank you.
Oh, brilliant. Thank you, everyone. So again, a positive story, but not an immediate answer to this. And I think fair to say that this time next year, when we're having an AGM, there's probably an update will be that bit closer, and it's a good thing to come. Right. So another question now. Why are doctors not suggesting routine HIV testing for sexually active people? If they're not suggesting HIV testing, how would someone know that they needed testing if they had unprotected sex? UK has a plan to stop new cases of HIV by 2030, which requires more testing. Not everyone has the courage or the knowledge to get tested at sexual health clinics. Tom. It's the Tom show, sorry.
Thank you. Well, it is, sorry, just to say, it is great that people are asking these questions. I do think it's wonderful. I would be happy to continue answering them all day, but I believe this is the last one for me. But again, it is a great question. For me, this sort of splits into two different areas. One is about what are we doing with healthcare professionals to inform them, and the second is around access and what we're doing there. And I would like to say, and I do think that this is, I can say this on behalf of all of our public health teams, we all know that we can always do better, even if we're always doing the very best that we can. So again, that's why being challenged on this to say what you're doing. I have an answer, but that doesn't mean that we should stop, and it doesn't mean that we shouldn't continue to try and do things better. So as part of the HIV action plan for Wales, we're raising awareness about HIV among healthcare professionals. And so there are a number of different things that we're doing in that space. There are short animations that have been added to the electronic staff record system for healthcare professionals to access. The Terence Higgins Trust is training healthcare professionals. There's an upcoming HIV Confident Building a World That Welcomes and Respects programme happening. We have feedback as part of late diagnoses cohort reviews, which explores and looks at how opportunities missed as training as a result. So it's always important to recognise that you will sometimes miss things and you should learn from them, and that is an important part of the system that we should implement. All GPs receive a flyer explaining about testing and indicators for conditions, and that was in Feb 2024. Presentations have been made to GP training events on bloodborne viruses and the importance of offering testing, and text for testing projects are underway at the moment, with GP practices in autumn advising people to test. So, and GPs are currently being engaged in the project. This is not just about doing to, this is doing with the health community. In terms of individuals having access, again, this is a very known issue about people wanting to come forward, and Public Health Wales runs a sexual health testing and post service so that people can access testing without attending sexual health clinics for those who are digitally enabled. Separately, community kits are made available through services so that people don't have to go to a clinic, but also if they don't have digital access or don't want to access via that way, there are other routes. And there are a number of GP practices involved in the provision of that, also community pharmacies, and there are other community venues such as libraries and hubs where that's also working through. So again, this is something that we keep under review. It's something that we look to improve, but there are services there. So an important question and hopefully a helpful answer.
Lovely, thank you, Tom. And yeah, no, I couldn't agree more. It's been really good to have such a rich range of questions this year. I think we've got one more. I'm looking across. Have we got time for one more? Yes, okay, lovely. So the question is, what is our position on ultra-processed foods? These foods are increasingly linked to all disease conditions we're trying to influence, but there is no mention of them in any of our, as in Public Health Wales's, plans. So for this one, I go to Jim, and this was a late arrival question, so I'm looking at Jim and hoping he's got a jolly good answer.
It's like exam day, isn't it? Yeah, that's a really good question. So there's two parts to answering this. The first is to look at things that are in our control in Wales, and the second is to look at things that aren't in our control. So if you look at things that are in our control, the first is we can do some stuff around healthy eating in schools and the type of ultra-processed food kids get in schools. We've just finished a consultation where we've supported Welsh Government on that, and there are regulations coming on healthy school food. So that's one plank. The second plank is, you may have noticed that Welsh Government has promulgated regulations on the sale of high-fat, high-sugar promotions, which will come in next year. Not this year, but those have come through this year. That will also target ultra-processed foods. That's two things that will start to make a difference. The third thing that we're doing is we are working on commercial determinants of health to look at how we work with commercial actors around reformulation on the things we can do in Wales. And that takes us into stuff that isn't in our gift. So the stuff that isn't in our gift is a lot of our food supply comes from across the border. So we have to work on a four nations basis around things like reformulation. So the answer is there are several sets of work going on. If the person wants to talk to me, I'll show them where they are in our IMTP and in our plan. I'd love to hear what more we can do, but some of it is about advising government because we can't pull levers, and some of it is about helping government write regulations. Another bit is about working with the rest of the UK to do it. But we are determined that that is something we need to do.
Lovely, thank you. Excellent answer. Right, I think we've got a couple of minutes to throw this out to the audience, by which point I'm just going to check this works before I do, otherwise I've lied. Lovely, okay. Question, I don't know, is someone, you've got the microphone. Lovely.
Right, I've got a question about COVID vaccinations. So I don't know who'd answer that one. So a bit of background. Can you hear me? Yeah. So I'm 51, my brother-in-law's 59, so we're both under 60. I fall under Hywel Dda, he falls under Betsy Cadwaladr, so up in North Wales. So he has asthma, I don't, but I do use a dry inhaler. So, so going out on last year's decision, he wasn't offered the COVID vaccine, but I was. So my question is the eligibility for the COVID vaccine the same across all of Wales? And if so, what was the reason why he didn't get it? Because I would have thought that asthma would have been a condition that you would get the COVID vaccine.
So I believe that it is the same eligibility criteria across Wales. We would need to look into the specifics because the colleague who would answer that isn't here with us at the moment. But it's, again, yeah, it's good to have that question and that challenge.
And just to say that while we get involved around looking at the changes in advice and eligibility, the implementation of all of that happens by health boards. So we're a kind of couple of steps removed from that. But every year the eligibility is approved by a UK group that advise on vaccinations, including COVID vaccinations. So it should be the same. Some of it's down to what data exists within GP practice and the records about a patient. And that may or may not have made a difference as to how that converted into you being eligible and him not. And that would be a kind of GP health board decision, and which probably isn't very helpful. So we may be limited in what we can advise, but it should be consistently applied. Does that help?
Yeah, a little bit, yes.
Oh, thank you. Thank you for the question anyway. That was...
Is there any way online I can look to get more?
Yeah, so we could put that question and have a look at getting an answer for you up online, and you can get that on the QR code for our website. So, lovely. Thank you, everybody. I am going to hand back to Pip. Oh, sorry. I'm in.
Iawn, dwi'n mynd i ofyn y cwestiwn yn Gymraeg. Gai just checio bod yr offer cyfieithu'n gweithio. Ti'n clywed? Pawb yn clywed? Reit. Yn gloi. Gai just dweud bod fi wedi mwynhau'r prynawn yma. Mae wedi bod yn wych. Beth dwi wedi clywed yw hyd y lled y gwaith i chi'n neud fel corff, bod chi'n cynllunio 10 mlynedd mlaen, a bod chi'n dibynnu yn llwyr, i ddweud gwir, ar bobl. So gai ofyn cwestiwn i chi ynglyn â shwt i chi'n gweithio gyda colegau a phrifysgolion a prentisieithau yng Nghymru i sicrhau bod y ffynhonnell yna o weithwyr yn mynd i fod na mewn 10 mlynedd.
Yeah, so Ian Bell, dwi cyfarwyddwr digidol data a ymwchol. So Ian Bell, Director of Digital Data and Research. We've been doing a lot of work to try to strengthen our links into universities and academic public health in Wales. I think there's two elements to that. One is to making the research in Wales an absolute powerhouse and how we can co-create with universities a really strong vision where we're bringing high quality research into Wales and bringing funding with it to develop our economy and the academic sector. And then the second aspect is much more about how we work around the public health training programme, how we deliver that and make sure we have the public health workforce of the future. But it also goes way beyond that, because public health in the future is going to require many different skill sets. So it's how we work across with digital, bringing digital people through, how we bring those skills into the organisation and developing links such as it. And also we've recently, as a board, invested into apprenticeships in order to strengthen our apprenticeship offer and bring that in. And I believe we're looking at how we get our first apprenticeships in the next year or two. So that was the bit I wanted to mention. I'll hand to Robin or Rachel if they want to add in.
Thank you. So, sorry, I can't respond in Welsh. But in terms of infection, our links with universities are both to do with supporting teaching and training, but also to do with research. So we have a number of colleagues who have very close links with academia and honorary chairs in Bangor, Aberystwyth, Cardiff and Swansea universities. In terms of training, our workforce is predominantly biomedical scientists and medical staff and physician assistants. And we're engaged with all the universities who are delivering that training. So we work very closely with Cardiff Metropolitan and Bangor universities with regards to biomedical science training, and we support the physician associate or assistant training that happens in Bangor and Swansea, and we're supporting the medical training in Cardiff, Swansea, and now the new postgraduate training in Bangor. And we're really keen to be involved in those areas because, as you say, they're our workforce and we want to grow them, and we want to grow them locally because, apart from anything else, experience is that says that people stay where they train, and so that's really important. And so we're open to any further approaches to expand that.
Lovely, thank you everybody. And obviously our university member on our board is currently open, and I think we're looking at having interviews in the next couple of weeks, so hopefully that will be a big move forward as well. Now, I can only apologise for my terrible vice chairing and pass back to my chair with not enough time to finish off, so apologies. But thank you so much everybody for those questions, it's really, really good.
Diolch, Claire, and you did a fantastic job. So you didn't overrun by too much. But it's always really interesting to hear the questions that everybody wants to bring, and really important because it makes us think in a different way, and that's really important to us all. So that's going to bring our annual general meeting to a close this year. Just before we go, I do want to pass on some special thanks to Liz and Steph, who've done a tremendous amount of work in organising us all to get us all here today and organise the kind of transport and the room and everything, and to make my job and everybody else's job who's presented so much easier. So I just want to thank Paul and his team, really a very big thank you to Steph and Liz in particular. And thank you. And thank you all for attending, coming to the AGM, to the annual general meeting. It's really important, I think, for us to take the opportunity to reflect on what's happened over the past year and the successes and the challenges, and the fact that I think it's been quite clear that we're none of us afraid to shy away from some of those challenges as well. So for me, that's really important. And I really want to thank you for the site visit this morning and our wonderful guides this morning. Thank you very much, Ian and Richard, for that. Really appreciated the conversation, and good luck with the archery. There's going to be a full recording of this event that's going to be available and uploaded to the website in the next few days. There's copies of the annual reports. There's some hard copies, as Tracy said, on the desks if you want to take them with you. And also they will be published online for people who don't want to cut down another tree today. So thank you very much, and very much safe journey home. Gobeithio dim bwrw glaw on the way home. And thank you so much for attending, and we'll see you all again soon. Thank you.